grew up in North Carolina where I was born and raised. My grandparents raised me. My dad left when I was about 2. My grandparents taught me the value of dedication and perseverance, integrity, ethics, and hard work. I decided orthopedics was a way that I could work with people, I could work with athletes, I could work with an aging population. I could see the results of my surgeries. I could see somebody transformed almost overnight. I'm a guy and I like to work with my hands. I feel like a carpenter of the spine. I feel like hope is a powerful emotion. I think it's the most powerful of human emotions, which overcomes the second most powerful emotion, which is fear. Patients come to the office with this fear that they're going to need surgery, fear of the unknown. They're afraid the surgery may not work. So I think hope allows the patient to see beyond the fear. In spinal surgery, somebody's had debilitating pain for 10 or more years. They've been crippled for 3 years, they're in wheelchairs, they have no hope, and I can restore hope in their lives by fixing their backs. Let me tell you about a patient of mine named Joe. He's 68, he's retired, and all he has to do is live for his grandkids. That's what he enjoys in his life. He never picked them up before. He had tried every conservative measure for spine care, and he was scared of surgery. He came in with the fear of the unknown. I was able to give him hope. I was able to restore his life. Joe was able to play with his kids again and pick them up for the first time. If physical therapy, chiropractic, or injections don't work, I'm there for surgery, and I can help them get their life back. And there's also different products that are being launched and different approaches to spine care that include non-operative care. I think there's a lot of hope and a lot of potential for patients with spinal conditions in this day and age. At the end of the day, I provide hope for my patients. Welcome to the Minimally Invasive Spine Institute. We offer the most state-of-the-art, technologically advanced surgeries in a minimally invasive profile to perform on the neck, back, shoulder, hips, and knees. We have minimally invasive surgical procedures for the cervical spine, the lumbar spine, the shoulders, hips, and knees, and extremities, usually within incisions as small as 1/2 of an inch. The pain management procedures include nerve blocks, facet blocks, SI joint injections, discographies, and kyphoplasties. Our spine surgery procedures are all minimally invasive, allowing patients to go home the same day. Those include cervical and lumbar fusion and stabilization procedures, SI joint stabilizations, decompressive procedure for nerves, including discectomies and laminectomies, and kyphoplasties, along with spinal cord stimulation. Our arthroscopic orthopedic procedures are directed towards the shoulders, the hips, and the knees. The incisions are about 5 millimeters, and the surgeries take less than half an hour. Our foot and ankle procedures include those for peripheral neuropathy, bunions, and toe deformities. Our hand procedures are geared towards peripheral neuropathies, including carpal and cubital tunnels, and for trigger fingers. At the Minimally Invasive Spine Institute, we focus on musculoskeletal conditions, including those for the neck, back, arms, and legs. Our center focuses on pain management injections to arthroscopic surgeries to open surgical procedures for the spine. Our spine surgeries that we offer are discectomies for decompressions of nerve roots, fusions for stabilizations of the lumbar and cervical spine, as well as the SI joints, and kyphoplasties, along with spinal cord stimulators. Our arthroscopic procedures for the shoulders, hips, and knees involve very small 5 millimeter incisions and can take less than half an hour. What makes our facility different from other facilities is we have direct control over the patient care. I have a patient who was in so much pain for 14 years, and the stabilization procedure for her SI joint has brought her complete relief of pain for the first time in 14 years after undergoing previously 17 spine surgeries in California. This patient was depressed, anxious, helpless, and hopeless. The new technology of the stabilization procedure has returned her life. She can pick up grandkids, she was able to cook for Thanksgiving, she's able to enjoy her life once again. Ruth used to come to the office and cry in pain. Now she has tears of joy. Stay tuned to hear more about Ruth's story.
My name is Ruth and I'm from Summerlin. Back in 2001, I got hurt on the job, and it required me to have surgery on my spine, and it led to another one, and another one, and another one, up to 14, until I knew it was time to see a doctor when I couldn't walk anymore or bear the pain. So I went seeking for help and came to Vegas and found it. Off the chart. I mean, unbelievable. Even in my dream, the pain was there. I couldn't walk. I couldn't really do anything. I couldn't get out of bed. I couldn't fix my food. I couldn't take care of myself, and it was just horrible. And it just didn't let up. Initially seen a doctor in California who did my surgeries, all of them. And when I moved to Vegas, they recommend Dr. Cash. And that's how I got to see him. And I thought I was really lucky because he's really, really busy. And I was lucky to get him. And I know how blessed I am now because he really has taken the pain down. My prior doctor recommended Dr. Cash because he said that he was one of the best in Las Vegas. And coming here, I also felt that I was in good hands and didn't have to worry. And as the visits went on and I got to come more and more, then I felt relaxed and felt like he knew what he was doing and that he would take good care of me. So I felt really good. At DIS, I received therapy, different ways of trying to bring the pain down, trying to discover where the pain was coming from, and finally we decided to do the SI treatment, and it worked. It worked, and I'm happy. I'm not in pain like I used to be. I'm able to walk. I'm able to go out with my grandkids. I recently was able to attend my granddaughter's wedding, and that felt good. And I'm able to do more than I ever was capable of doing before I had the surgery. And it's like I wake up in the morning and I'm looking for the pain and it's not there. And it doesn't wake me up in the night. And when I get out of bed and take the steps, the pain is not there. So I'm really grateful for Dr. Cash. I'm able to start to work on my overall health. I teach people how to cook. Now I can get back into that. Thanksgiving is coming and I'm already planning my meal. My son is getting ready to be deployed. So this Thanksgiving is going to be real special. And I'm able to do it. When I first started coming here, you don't get that feeling that you're meeting somebody you never knew before. You come in here and everybody is smiling and they say hi and they know your name.
You had a lot of back surgery before you came to see me. I mean,
Yeah.
you had a lot.
A lot.
I've been doing this for a while, and the x-rays you had, I knew you had a lot. How many back surgeries did you have before you saw me?
About 14, but going back and coming out of surgery and having been rushed back in, so I'm going to say about 17 to 18 times.
Okay, now that's more than average by far. When I saw you the first time, you had 4 levels fused in your back. You really had about 5 functional levels.
Yeah.
You had the front and the back operated on, multiple laminectomies, multiple spinal leaks previously, complications from having
Yes.
revision surgeries.
Yes.
And it's very brave of you to even consider going to a spine surgeon's office, having had so
Yeah.
many surgeries before.
It was scary.
So I'm proud of you for being
Yeah.
a brave. But I think the pain that drove you in here just overcame your fear, right?
The pain and the fact that I was told so many times that there's nothing we can do for you, like I was just being thrown away. There was one time when they took my case to a medical convention, and they presented it, and the doctor said he asked them how would they treat this patient, and said that they said that they would give me a lifetime prescription of pain pills, a psychiatrist and put me in the corner. And so I didn't like that, and I wanted to prove him wrong. I wanted to prove him that I could get better. And so doctors like you that don't give up and give us that hope that, you know, there is something that can be done, and that you can, you don't have to live in pain like I was, is what kept me coming.
Absolutely. We'll never give up on you or any other
Yeah,
patients.
okay.
And, you know, it was kind of a daunting challenge to see 4 levels that were fused, screws broken, and still actually is broken in there. But we were able to diagnose your
Yes.
SI problems, which is widely underdiagnosed and non-diagnosed in the medical community for many reasons. But we're on top of this diagnosis at my office.
Yes.
And luckily, instead of being relegated to a lifetime of pain medications and a psychiatrist and sitting in the corner, I wish I'd been at
Yes.
that conference, it would give them
Yes.
a better answer, or a spinal cord stimulator, which is helpful for a lot of people with
Yes.
multiple back surgeries, but
Yeah.
still not great. There's some
Yeah.
downfalls with it. There's some
Yeah.
cons and pros. We're able to identify the SI joint as a problem. There's also somebody who cares about her own health. You know, more than doing a surgery on somebody, a patient that is involved in their own care and takes it by the reins and wants to get better will have a better outcome. That's the number one predictor
Yeah.
for successful outcome, along with patient selection and a good
Yeah.
surgery. And just a prime example.
Yeah,
Ruth.
it's great. Thank you.
Thank you.
Thank you so much.
I woke up one morning, it was back in May, got up out of bed, went into the bathroom trying to get ready for work, and my leg was like totally numb. And I didn't know what it was. I figured maybe I slept wrong or something like that. So I just waited, you know, figured maybe a day or two it'll go away, and well, it never went away. The surgery was just, it was actually took longer to get ready for the surgery than it did for the surgery. The surgery has lasted roughly, I guess, for about 45 minutes and stuff. And when I woke up in recovery, they said I need to get you walking, so they sat me up, put back brace on. And as soon as my left foot hit the floor, it's like, oh, this is great. Had all the feeling back in my left leg.
My name is Scotty Briscoe, and I am a patient of Dr. Cash. I had several injuries on my back a couple of years ago. I had a car accident and injured my back, and then I suffered some pain throughout that period of time. And then 2 years later, I was picking up my grandson and my back snapped. And then I was unable to stand up straight, and I limped, and my pain was excruciating from there, from my hip down to my toes.
When Scotty first came to the office, she was really a wreck. She had suffered from back pain for years. Over the last several months, it was getting so debilitating, she had pain, numbness, and tingling going down both legs. And she had tried almost everything conservatively that she could.
When I first arrived at Dr. Cash's office, I thought it was very neat and clean. The setup was nice, and the decor was beautiful, and surgery is always a last resort for him. And so when I did try the pain management and it didn't work, then I came back to Dr. Cash's office and I talked to him, and I told him I wanted him to fix my back. And at that point he knew that surgery was the option for me. Surgery went really well. I felt nothing. I had no pain when I came out of surgery at all. I was ready to go. I was ready to move. Having Dr. Cash do this procedure on my back has completely transformed my life. I'm a new person now. I feel brand new. My back feels great. I can do whatever I want to do now.
My name is Suleiman Al-Nobani. I live in Henderson, Nevada. I got in a car accident, and I got in a big problem in my neck and my back. So I went to a doctor to see what I can do for my health condition. They keep giving me injection and multiple time, and the pain level is very severe. I can't walk unless with cane. If I walk 50 feet, I have to stop. So after that, I start looking for a doctor to take care of me, and one of my friends recommended Dr. Cash. I come here and I was scared, because you don't know what will happen, go from doctor to doctor is a problem. And it's hard to find doctor to trust. When I come here, These people treat me like family, and I meet him. He's have a good smile, and he look at my MRIs, and he did a diagnosis with me. He recommended for me something called discogram. I went, I did that, and he told me which level I need surgery for. He explained the surgery for me, and when I'm in the recovery room, I want to check myself if I can move my legs, because I thought I can't walk, because it was level L5, S1. So I move my legs, I can move them. And I was so happy just to move my legs. Then the second day when they come to try to make me walk, and I start walking like a few steps, I was so happy. My life changed with Dr. Cash. Now I can walk a mile with no problem. My pain level is gone from my legs. And I recommend Dr. Cash to anybody. After the accident, my limitation for walking is got very bad, because I have numbness, I have like needle shooting in my legs, my lower back, my upper back. But after that, I went to a doctor, and when I went to that doctor, he keep injecting me. He injected me over 7 times. And like I told you, I come here, and I was so happy with it. Now I can walk a mile, I can do things, you know, no problem, no pains at all. It's like a magic. Thank God for Dr. Cash. Third day, I walk like over like 50 feet, you know. So I can control myself, I can stand. Then after like 1 week, I start walking almost 200 yards, 300 yards. Then after that, I start walking a mile, no problems. My pain in my legs, my tingling, my name going through my butt is gone. I was amazing. I know I'm a new person. He gave me different life now. I'm so happy. Before I thought I'm gonna keep walking with the cane, and everybody's staring at me. Well, this guy, if he walk 50 yards, he sit down, you know, taking a break. He changed my life, really. You know, I love Dr. Cash so much. I recommend Dr. Cash to anybody.
All right, Solomon's one of our better patients, and one of the reasons is because he's really concerned about his own health. He is proactive, and he's dedicated, and he's compliant to the recommendations. One thing that sticks out in my mind particularly is when he came in, he knew his MRI like the back of his hand. So when we ordered a discogram, which is another test that we put side by side with the MRI to compare what to do, I determined we would operate on a certain level. But he was astute enough to realize that the other levels in his disc had findings. And so you want to talk a little bit about your concern and how we came to resolution?
When I come to Dr. Cash, I was looking at my MRI, and I told him my pain is in different level. So I was wanting to operate in the MRI, what the result of the MRI is saying. So Dr. Cash told me, no, we have to do your pain. When I examine you, it shows something else. So he told me, I'm going to order something called discogram for you, and it will show me clear where is the pain level and which nerve is the pressure in that level. So I told him, are you sure that will happen? He told me yes. So I went and I did the discogram, and he was right. I was thought, no, the MRI said this, and he want to do something else. But when I find out he's right, I'm so happy. I'm so happy I listened to him and I did that.
But the main take home is the MRI findings didn't dictate what the problem was. His clinical examination and his history did. The MRI we consulted confirmed that, but also had some other discs that could be the problem. By doing a discography, it also matched up. We were able to do a 1-level surgery instead of a 3-level surgery. His trust in me is appreciated, and also his astuteness to his own care.
I really appreciate everything he done for me. I'm glad I listened to him, and thank God for this surgery. It changed my life. Thank you so much.
Thank you.
Yeah.
My name is Brad, and I live in Las Vegas, Nevada. 2012, I fell backwards out of a chair. The back of the chair was broke. It was actually a bar stool, and damaged my L4, L5. Just before my surgery, I couldn't even walk. I was slumped over, in pain 98% of the time, so I was pretty bad off. Well, during the accident, I felt a little bit of a pinch, and I sat back in the chair for, I don't know, 5 minutes, maybe 10. I felt a little uncomfortable, and then when I stood up and started to walk, I felt like a knife pain in my back. Yeah, when I went and sat down in my truck, it felt like somebody stuck a knife in my back and it ran all the way down my left leg. The worst pain I ever experienced. Before I saw Dr. Cash, I was going to the chiropractor and he worked on my back, stretching my neck, trying to release the pressure off my lower back. I must have seen him for 6 months, maybe 8 months, and I would have good days and bad days. I had more bad days than good days. When I came and saw Dr. Cash, he walked me through the pain I was experiencing, and they did x-rays on my back, and they did MRIs as well, and he explained to me everything that was going on there. He actually told me that Dr. Cash was a spine specialist in Las Vegas, and that from people he had spoke with, he did really good work, which made me feel confident, because I've always heard, don't get surgery on your back. It's the worst thing you can do. So I was hesitant, I was afraid to actually come to a back specialist, but I was in so much pain, I had no choice. I had to, and I got so bad, I was taking baby steps. I couldn't even walk full steps. I had gotten so bad I needed to have the surgery. Actually, right after the surgery, they woke me up from having the surgery. And the nurse said that she wanted to transport me into another bed. And I said I'd walk. And I actually stood up and I walked to the other bed and laid down after the surgery. I didn't have the pain. I felt the difference right after surgery. I received a lumbar fusion from Dr. Cash, L4 and L5. And I could feel the pain wasn't there right after the surgery. And I walk normal. That's what's the most important thing, is I walk normal and the pain's gone. I don't have pain anymore. I'm back to work and I feel great. The level of care that they've shown here to me is over and above. Dr. Cash actually really cares about his patients. He spends that extra time and talks to you. And he's interested. He's interested to know how you're feeling and how you're doing. And the staff are just great. I mean, they're all caring people. They go the extra mile to make you feel comfortable, to make you happy.
So Brad was miserable when I first met him, and he had had a lot of pain and gone through a lot of treatments for his back, and nothing was working, and we tried to do everything conservative, and we hope that they've tried everything conservative before they come to the office, because spine surgery is the last resort, but his back was pretty messed up. And he was a big guy, hard-working, athletic guy, and he's had some arthritis in his back, but certainly I didn't feel like all the arthritis was activated by his injury. What happens a lot of times is people with arthritis in their back is just, they're 50 years old, they have an injury, and they injure some aspect of a disc or other part of the spine, and that's what happened with Brad. So tell me a little bit about what pain you're having and what your concerns were when you first came in to see me.
I was having a hard time walking. I couldn't walk, I couldn't sit, I couldn't sleep at night. It was just miserable life. It was hard to deal with every day. Sleeping maybe an hour, 2 hours a night. I couldn't work, I couldn't do anything. Sitting in the truck, I'd get pains all the time. It was just hard to deal with.
Yeah, so he came in to see me about the tolerance level that we have when we recommend surgery. When patients can tolerate their pain, then we recommend they don't undergo a big invasive risky procedure like surgery. If somebody came in with a 3/10 pain, it's unlikely we're going to get them much better than that with surgery. If somebody comes in with higher levels of pain, increases the opportunity for us to improve their level. What we did with Brad is he had a good workup. We went extra steps looking at the diagnostic studies, including the discography, which helped us determine that not all of the areas that looked bad on the MRI were a problem, and we could fix this problem with just a 1-level surgery, which has a better outcome than 2 or 3 level surgeries in general, but we could get the maximum improvement for the minimal amount of lumbar fusion that we had to do. So tell me a little bit about how you've been since the surgery.
When I was having the problems, actually, I went to Thomas and Mack, and I couldn't walk up the stairs to leave. It took me 15 minutes to walk up 20 stairs. And now it's like I just walk up it, not a problem at all.
Yeah, I mean, can you imagine 15 minutes up 20 stairs? And not just that one time, that's your whole life, one after another episode of that. If you come in with the same motivation and dedication and guarantee that you're going to take the best care you can come up with a great result like Bradley did.
Absolutely.
So Brad, you've had a great recovery, and it happened a lot sooner than I thought it would for a lumbar fusion, especially in a big guy with all the stresses of your weight and walking on the lumbar fusion. And you were gung-ho and ready to get back to life. You'd waited
Yeah.
so long, you're chomping at the bit to get back to all these activities you just talked about. Tell us how you were compliant and to be able to restrain yourself from going back and potentially re-injuring yourself or jumping back into it too soon.
You know, I just took my time. I started doing little exercises. Every morning, every afternoon, I would tighten my stomach. I've actually lost weight since I've had the surgery, which is huge. I've lost 25 pounds. I feel better, but doing the exercises is what helped a lot. I wasn't in a lot of pain after the surgery. Uncomfortable sleeping at night sometimes, but the pain was gone. That's what was important.
Yeah.
Well, I mean, I couldn't walk, I couldn't exercise, I couldn't do anything because of the pain. And once I had the surgery, the pain was gone. And I'm just doing my back stretches, and I'm feeling good. I feel real good.
It's very important after lumbar fusions and any other surgery that patients are compliant. He did a great job with core stabilization, post-operative physical therapy and rehabilitation, maintaining his core to prevent him from having another injury at another level and messing up his surgery. So great job. You should experience success and happiness for a long time.
Absolutely.
As you'll see, our facility is beautifully decorated, is very warm and welcoming, has earth tones, and gives you a spa-like feel that you would enjoy in a plastic surgery office. We have a hand-picked staff to give you an intimate feel and the best care available to cater to all of your needs. Our goal is simple: improve patients' lives through better outcomes. The benefits of having your procedures performed in our surgical center is you reduce hospital stays and hospital complications. The fact that we do everything with a state-of-the-art technique and using minimally invasive procedures, you reduce trauma to the muscles, tissue tearing, tissue destruction, blood loss, blood transfusions, and pain. And by doing so, you improve your recovery back to life, work, and play. We only focus on minimally invasive procedures because we want to accelerate and improve your recovery back to life, work, and family. Traditional lumbar fusions incorporate a hospital stay of 3 to 4 nights in the Valley. It could be encumbered by intensive care unit stays, and you may have a rehabilitation stay for up to a week. Our center focuses on minimally invasive techniques to remove all of that headache and hassle. Our philosophy is simple. If you can have a procedure performed safely in a surgery center, it beats going to the hospital. I'll give you an example why. To contrast a hospital stay where a lumbar fusion will require 2 to 4 nights of stay, it might involve an intensive care unit stay, and sometimes even a week-long rehabilitation stay. Our surgery center focuses on techniques to give you the same advantages of a lumbar fusion, but you're out in 2 hours. You're home by the time lunch is served, and you're home before I am that day. The philosophy we have at this center is minimally invasive techniques to reduce hospital stays. An example would be a hospital stay that involves 3 to 4 nights after a lumbar fusion. You might have a couple of days in the ICU, and you might have a rehabilitation stay for up to a week. Our center can do the same surgery safely, efficiently, and at a cost benefit to the patient, as well as getting them home the same day.
My back problems began many years ago, I believe in the 70s. And they weren't serious, just back pains ordinarily. And as time went on and I got older,
I was in an escalator accident. The escalator broke and threw about 100 people down. I went down about 80 feet in about less than 10 seconds.
The last accident I got into just pretty much put an end to doing anything at all. I mean, it was, life just kind of like ended right then.
One day in December, it was actually Christmas Eve. I was skiing a mogul run, didn't wreck or anything, just felt something weird in my back. Basically, I hit a mogul too hard, and I couldn't walk for the rest of the day, basically.
I hurt it so bad when I went to him. And I told him to just do whatever it takes to get rid of the pain. Plus, I was bent over. I couldn't even straighten up.
And the pain that I was feeling on my right side was like a hot poker had been shoved from my back through my groin. And I was in just constant pain all the time.
He told me, I'll fix you 100% or I'm not even going to touch you.
The first visit I do with Dr. Cash, I was coming walking with a walker, and after the surgeries, I left the walker. I started walking with a cane, and after the year, I left the cane.
I'm very excited to introduce you to the most revolutionary spine advancement that has happened in my career. The SI joint stabilization is a minimally invasive way to fix patients that we didn't have before. It's essentially curative for an SI problem, and in studies that have followed the patients out 5 years, it's reduced their pain scale from 8 to 2/10. The elegance of the SI joint stabilization procedure is through its simplicity. I'm able to put small devices across each SI joint with only a 2-inch incision, whether the patient weighs 100 pounds or 300 pounds. We can do more surgically with less incisions. The benefits of the new SI joint stabilization procedure are that the success rates are tremendously higher and the complication rates are tremendously lower. Low back pain is epidemic in our country. 85% of all people will have some form of back pain, and 40% is related to the SI joint. Low back pain is second only to the common cold for a number of doctor visits every year. Up to 40% of all low back pain has an SI joint component. The way I diagnose SI joint dysfunction is through history and physical examination. After the physical examination is performed, comprehensive examination of the SI joint with provocative maneuvers confirms the diagnosis. A reconfirmation is performed with diagnostic injections in the surgery center. If the pain recurs, the patient is a good candidate for the stabilization procedure. Patients with SI joint dysfunction fall into 5 classic categories. Number 1, previous lumbar fusion. Number 2, chronic debilitating back pain. Number 3, motor vehicle accidents. Number 4, falls to the buttock or to your side. And 5, postpartum moms. Before offering this technique to my patients, I wanted to study it first to make sure it's going to have reliable results. I went to private academic centers to study the procedure on cadavers and live surgeries. I studied the technique in didactic sessions and training sessions. I looked at the long-term follow-up and success rate most importantly. I'm one of the only surgeons in the Las Vegas Valley offering this technology to patients. I'm one of only 3 doctors that have been allowed to teach this procedure to American surgeons as well as international surgeons. Of all the ways to perform a lumbar fusion, the OLIF is the least invasive. The OLIF procedure stands for oblique lumbar interbody fusion. Patients that will benefit from the OLIF procedure include those with chronic low back pain, with or without a component of leg pain. Structural injuries that are addressed by this procedure include disc bulges, disc protrusions, and disc tears. Lumbar fusion technology has come a long way. Please come in today to find out what kind of advances lumbar surgeons have undergone. The advantages of the OLIF procedure over traditional lumbar fusions are numerous. They include less surgical trauma, stripping muscle from the bone, less scar, it's less than 1/2 of an inch, less infection risk, less blood loss and transfusions, no risk of abdominal surgery, outpatient facility, you go home the same day, it's a faster and easier recovery for rehabilitation, and you keep the strength of your back muscles. Treatable conditions for the OLIF include sciatica or leg pain, bulging or herniated disc, stenosis or narrowing of the nerves, disc degeneration, spondylolisthesis or slip discs, and painful annular tears. You can see from the diagram that this oversized implant is only about 1/2 of an inch long, requiring only a 1/2 of an inch incision, which is smaller than a paper clip. Traditional lumbar fusions can include an 8-inch incision. This incision is only 1/2 of an inch or less. As you can see, the SI joints are contained in the pelvis here. You have one on each side of your pelvis. It connects the sacrum, which is the lowest functional unit of your spine, to your pelvic rim on each side. When you get inflammation and painful motion in the SI joint, it leads to spot-specific tenderness at the SI joint on your back and often radiates down the leg. Many times this condition mimics other disorders of the back, including lumbar radiculopathy and disc herniations. The stabilization procedure I offer fixes this problem by putting an implant just across there using just x-rays, and you're home the same day. So you can see the location of the SI joints are in the pelvis, and it's magnified over here to show you the implants across the structure. The implants are inserted through a 2-inch incision, so you can see it's been magnified just for illustrative use.
Since my surgeries, the quality of my family life has dramatically changed, and I have two young children, I should say, and they got their mommy back.
One of the best feelings was being able to, get back on the streets, get away from that desk. I became a police officer to be able to patrol the streets and keep people safe, and I wasn't being able to do that behind a desk. So that was one of the best feelings, to be able to, get back in the patrol car or whatever the case may be, and go out there and chase bad guys. I mean, keep the city straight, or safe, I should say, keep the city safe. And basically Dr. Cash gave me that ability back. He gave me my life back.
And I think this young doctor is going to go a long way. He's one of the best. He cares about people.